Basically, we're talking about biopsy of a couple of cells from the embryo on usually day 5 of its development, and examination of these cells in a genetic lab, seeing whether they're chromosomally sound, whether genetically everything's okay with the embryo, thus promising its bright future. PGT-A, the pre-implantation genetic testing for aneuploidies, or it was earlier called the pre-implantation genetic screening, is the basic methods when we see that the number of chromosomes in each cell of the embryo is as expected, and it can be used as a tool for embryo selection for transfer, especially in a situation where there is a higher number of embryos following the stimulation, fertilization of the eggs, and the embryo cultivation in vitro in the lab until day 5 or 6. So this gives us a chance to narrow the field, if I can use that term, and the number of embryos, which might be 5, 6, 7, to actually only those that are chromosomally genetically sound and have a very good chance to then continue nest and continue their development. PGT-SR is another method, more advanced. It's a pre-implantation genetic testing for structural rearrangements, where actually they see in more detail whether there are translocations, deletions, inversions, insertions, and other pathologies in the individual chromosomes. The third method is PGT-M, or pre-implantation genetic testing for monogenic diseases, which is the most advanced, and it's used actually for specific genetic problems in situations where one of the parents, or possibly both of them, are carriers of a problem, of a gene mutation that we want to avoid in the embryo, or that actually would prevent the embryo from a successful development. It's important actually to have the karyotype in each patient, in the woman and the man, in each partner, examined prior to even thinking about one of these methods. And it's a good idea to discuss this with your gynecologist, with your IVF expert, or with the geneticist, which one of these methods is suitable for you, which one of them you actually need and should put to use.